everyone, and welcome to my first Vlogmas. This is Vlogmas episode number 1 from 2024. My name is Dr. Wright, and I have this wonderful channel, and I have a bunch of stuff that I've been collecting, and I want to give that stuff away to all of you during this holiday season. And so I thought I would do check in with you guys once a week, maybe a couple more times than that, and give away a bunch of stuff and kind of go over my day. Because I get a lot of questions about, what do veterinarians do? Questions, people always say, oh, I've always wanted to be a vet. My granddaughter wants to be a vet. Maybe there's some vet students out there, or aspiring vet students out there. And so I kind of wanted to give a little bit of a real day, firsthand, kind of explanation to that. So I'm going to kind of do a week in review with you guys. I hope you enjoy it. And at the end, we're going to have a giveaway. So this is the week of December 6th. I worked 5 days this week in the clinic, and it's only, what time is it? 3:08, so I still have a couple more hours in the day, but I had some time to film this, so there's time for more cases, but for right now, I saw 42 cases this week. Of those cases, 25 were dogs and 17 were cats. I don't do exotics. I do have an associate that does them, and I don't do large animals anymore. I used to do them, but I don't do them anymore. So 25 dogs and 17 cats, and I would say that's pretty typical that in veterinary medicine across the board, unless you're in like a feline-only specialty, and the number of dog patients usually does far outweigh the cats. This is actually closer to 50-50 than I would say it normally is. And we see that across the board, even like in YouTube and things like that. I get far more requests and views for dogs than I do for cats. Why is that? It's not necessarily that people don't love their cats more, because cat people are certainly very passionate about their cats. I think it's just harder to get cats into the vet. They tend to hide things a little bit more. They're for to some extent a little bit less expressive, maybe, or showing maybe certain symptoms than dogs are. And so there's a lot of theories about why that is, but across the board, just statistically in veterinary medicine, we do see a little bit of an underrepresentation of our cat patients. So 25 dogs and 17 cats. Of those 42 exams, 13 of them were wellness. So that kind of gives you an idea of, do veterinarians just see puppies and kittens all day and things like that? No, the majority of our patients are sick, and we are doing medical workups and rechecks, and surgical procedures on the majority of our patients. At least at my practice, there are certainly primary wellness clinics. But we are a general practice, and we kind of do it all here. We do surgery and wellness and internal medicine, dentistry, all that stuff in my practice. So that brings us into surgical. So I saw a myriad of surgical cases this week. I did 2 tumor removals this week. I did 2 canine spays. I did 1 Nares surgery. And so what is that? That is a surgery we do on the brachiocephalic dogs. This was a French bulldog to kind of open Nares. So, their noses are kind of squished like that. And it leads to a lot of breathing problems. So then, kind of do a rhinoplasty to open them up. So I did one of those procedures, and I saw it the day after, one day post-op, and it looked really good. So I have some high hopes for that one to kind of correct some of the breathing issues there. Did 1 fracture repair that we're going to talk about a little bit later, 2 feline neuters, and 1 dental prophylaxis this week. The highlights of the week, the case of the week. The case of the week is going to be the fracture repair that I did, and that's the one I kind of want to share with you guys today and kind of do a little client education on that one. And so this was a 2-year-old kitty. I can't remember if it was an outside kitty or he got out and came back limping, and they went to the emergency clinic, was diagnosed with a fractured leg, and then was sent to me for repair. And so that was Monday this week. We were able to have everything that we needed to do the repair, and then slide right into the repair on Tuesday. The fracture was a fractured tibia, and I'll show the x-ray here. The tibia is the shin bone in the dog and the cat, and I guess in the people too, right? And in addition to the tibia being fractured, the fibula was fractured as well. So that's a little bone that's on the side of the tibia. Now the tibia is the weight-bearing bone. That's the one that we focus on. The fibula is non-weight-bearing. It's kind of an accessory. And so in veterinary medicine, we focus on correcting the fracture of the tibia, and then the fibula will kind of follow suit without much finagling. And so this little kitty came to us, and we kind of planned out our surgical procedure. Now, he came with a splint already on from the emergency clinic, and that splint was just a temporary splint to provide some stabilization so the leg wasn't flopping around, and that helps with pain management. But, you know, it wasn't a permanent fix. Can you splint? You know, for the long haul, for fracture repair, can you splint animals' legs? Yes, you can, but it's a very limited use. And there's a number of reasons why, and I'll just touch base on a couple of them because I do get that question a lot. I know we utilize splints a lot in people, and so of course, you know, automatically our mind goes to, well, can't you just, you know, doc, can't you just splint it? Can't you just cast it? It doesn't work well for a lot of cases for animals because A, the shape of their legs, the cast and splints tend to slip, which, you know, this patient was already slipping. By the time it got to me, it was already slipped well below the knee, wasn't doing much at all, and that was less than 24 hours that the cast had been on. And that's to do with the shape of the leg. Other things, you know, they try to get it off, they chew it, they soil it, it gets wet, it gets sand in there, and then it leads to bandage disease and bandage sores, and especially cats, they don't say anything about it, and then, you know, 8 weeks goes by, and you've got a huge, you know, wound that had been happening underneath the bandage, and it's no good. The other reason is the mobility may not be properly restricted. And so you have to have restriction of mobility of the joint above and below the fracture in order to provide good stability there for the fracture to actually heal. This is fracture management like 101 in veterinary medicine. And so for a splint to work, the bone has to be displaced less than 50%. So that means it can't be 50% off in any direction. And so when you look at an x-ray, it's a one-dimensional view, and that's why we get a couple different views. But if that bone is off 50% in this direction, 50% off in any direction, it's not going to be able to heal with a splint. The other thing is actually the worse the fracture is, the almost better it is for a splint, because if it's really jagged, you can actually get those jags to like interlock, and it kind of holds things in place like Velcro. If it's actually pretty clean break, people say clean break, it's actually worse because that clean break wants to shift. It can slide all over that place like glass on glass, and so that's not going to work. Not only can it slip like this, it can actually rotate like this around itself. So, you know, you have a bone that's basically a tube. That tube can rotate around itself, and so it doesn't really work, right? So there's a lot that goes into planning a fracture repair. So we discussed all those things, and we decided the best case scenario was to go ahead and do a rod and plate configuration. And that's what we did with this guy. We kind of contemplated maybe doing even one of those external fixators where you get that big bionic like metal halo on there, but we decided to do the plate and rod configuration. And so we went ahead and did that. I'm not going to show the post-op picture because I don't want to jinx it. You know, sometimes when we do surgery, you know, we don't want to jinx things, so I'm not going to jinx it. Maybe 8 weeks from now, if this guy's walking, you know, I'll post the picture. But I will post this picture of his 2-day post-op, you know, picture of his leg, and you can see it's actually minimal swelling. I think he did really good. He was a really good patient, a really sweet patient, and so hopefully we'll see him back in 2 weeks to get the stitches out, and hopefully we're gonna have you know, some pretty good weight bearing happening at that time, and it'll be smooth sailing you know, for the 8-week recheck. So that was my week. Today did have a little bit of a bonus surprise from a client. We did a dentistry and a growth removal today on a patient, and the pet parents brought the whole clinic lunch, and so that was really sweet. So I really appreciate that. It was totally a surprise, and that really brightened our day as well. So that was another little bonus highlight this week, in addition to discharging you know, that surgical patient on some good my orthopedic repair on some good notes today. So that was my week, and hopefully I can brighten your week too, because this is where we're going to do the giveaway. Earlier this week, I can't remember what day it was, I posted a video about Tony and his new heated cat bed, and Avitavin actually sent me 2 cat beds, and so I want to gift one of those to you guys in today's video. And so in order to qualify for the giveaway, all you have to do is go to that video, and I'll link it down below and pop up one of those little things up here. Watch the video, I think it's like 3 minutes long, and leave a comment, and I will select one one comment randomly, and I will send it out to you. Now, little bit of a rules on this is going to be limited. This particular giveaway is going to be limited to the US because the package is quite large, and it's hard for me to mail those things internationally, but I do have some smaller package giveaways that I'll be doing later this month, and we'll get some of my international friends involved, especially because I know I have a lot of really good subscribers that are from Canada, so I don't want to leave you guys out. But this particular giveaway is going to be for the US only, so go over to that video, leave me a comment, and I will pick a winner in 1 week's time from this video. So today is December 6th. Will be Friday the 13th. Friday the 13th, I will pick the winner, and I will announce it. I will comment on your comment, and we will get you guys this package shipped. So I hope you enjoyed the first ever Vlogmas. I'm going to try to do these weekly. I have a lot of prizes to give away, so I think I might sprinkle a couple extra in. So be sure that you're subscribed and your notifications are on. And yeah, hopefully we'll have fun this month. And I wish you guys all a really happy holiday season. So I'll see you guys later. Bye.